can say thank you all for being on time this afternoon. We'll start in just a couple of minutes. We'll see if a few more colleagues are going to join, and then we'll begin. Thank you. Okay. Once again, thank you so much for being on time this afternoon, and really a warm welcome to this special session on food security as building blocks for social protection in Asia-Pacific region. My name is Kimberly Denny. I am the Senior Program Policy Advisor in the World Food Program Regional Bureau in Bangkok. I'm really honored today to moderate this panel and to be in a room with so many of you who understand social protection and food security, policymakers, other practitioners like myself, and other organizations you work for. And I know each and every day that you are really devoting your lives to helping those most vulnerable. So it's really a pleasure for me. Our panelists are among the leading lights in social protection in the region and also globally. So today they're going to share with us their experience and some inspiring stories and examples of social protection in the region, and how social protection can be leveraged to benefit food security and nutrition outcomes, and also how food security and nutrition can reinforce social protection outcomes. So, Nazma Mubarak is the Secretary of Bangladesh Ministry of Women and Children Affairs. Over the span of 30 years, Nazma has accrued extensive experience in field administration, public financial management, and directing development programs. She is responsible for two of Bangladesh's flagship programs, the Mother and Child Benefit Program and the Vulnerable Women Benefit Program. And we'll hear more about those in just a few moments. In the middle is Mr. Naveed Akbar. So Naveed has been working with Pakistan's Benazir Income Support Program, otherwise known as the famous BISP, for nearly 15 years, I would say, actually since its start, right, in 2008. He's held various strategic positions, both in BISP, but in other roles as well. He is currently the director of the National Socioeconomic Register Conditional Cash Transfer. So Naveed was instrumental in the establishment of this dynamic registry that we heard about this morning. But this afternoon, he's going to tell us about Pakistan's National Malnutrition Program. And then next to Naveed is Dr. Namrata Singh. She is Province Secretary in Nepal's Ministry of Agriculture and Livestock Development. Namrata has more than 15 years of experience in the civil service and has dedicated her efforts to improve food security in Nepal's food systems. She has experience developing policies and programs around food security and nutrition, including Nepal's National School Meals Program, and she's currently responsible for policy and programming around agriculture, land management, cooperatives, livestock, and fisheries. And then on the far end, Mr. Richard Morgan is the Global Director of Social Safety Net Programs at Nutrition International. He's worked extensively on issues concerning child well-being and development for more than 40 years. He's also the former Director of Policy and Practice at UNICEF and was the co-founded the Global Coalition to End Child Poverty. He is currently leading Nutrition International's work on evidence-based strategies for the integration of nutrition in social protection, and we'll also hear more about that today. Before we continue further in this session, it's really my pleasure actually to announce and share that we have a pre-recorded video from Nobel laureate and President of Timor-Leste, Dr. José Ramos Horta. So if you can please start that.
Dear friends, ladies and gentlemen, I am deeply honored to address you at the ADB's Asia Pacific Social Protection Week, where experts and leaders gather to discuss vital topics. As a young nation, Timor-Leste places great importance on food security, improved nutrition, and human capital development, issues that resonate across our region. Today, I would like to emphasize the transformative power of social protection in addressing malnutrition, fostering human capital development, and addressing the critical intersection with climate change. Malnutrition perpetuates poverty by limiting physical strength, impairing cognitive development, and increasing disease risk, all of which hinder economic opportunities. Climate change exacerbates these challenges by disrupting food systems, leading to food shortages and escalating prices, particularly affecting vulnerable populations. Its impact is often irreversible, passed on to the next generation, and undermines societal stability. Social protection is our solution for the most disadvantaged. It includes measures such as targeted cash transfers, food assistance, and education, addressing root causes of malnutrition and poverty, while building resilience to climate change impacts. Innovation is key. Technological advancements and creative contextualized approaches can empower individuals through education, skills building, and health, all while incorporating climate-resilient agricultural practices. In conclusion, national lead, robust social protection programs are essential for sustainable development, resilience to climate change, and breaking the cycle of poverty. Let's unite our efforts, creating comprehensive and contextualized programs prioritizing human capital development, nutrition, and climate resilience, shaping a future where every individual reaches their full potential. Thank you all for your attention, and I wish for fruitful discussion during this event.
So on behalf of all of us, just to thank the President for those inspiring words and also for his commitment to social protection and food security and nutrition outcomes in achieving those in Timor-Leste. Before I go to our panel to start some questions, I just want to compliment the President's statement with a few additional words to help frame our panel discussion. So colleagues, we live in some of the fastest growing and most dynamic economies in the world in this region. And yet, despite remarkable economic growth, we see stagnant progress and declining progress on certain development goals, including food insecurity and malnutrition. The economic crisis provoked by the COVID pandemic amplified really record-breaking food and fuel prices, and also the climactic events over the past couple of years. And here I'm thinking the floods in Pakistan, the heat waves in India, even here in the Philippines with Typhoon Rai a couple of years ago, and those that followed, have really hit poor and vulnerable households hardest. So millions of people have been pushed deeper into poverty and suffer from acute food insecurity. Nearly 2 billion people in this region, out of 3 billion globally, cannot afford a healthy diet. The high burden of malnutrition threatens the lives and well-being of millions of people, also their future potential and productivity and the future prosperity of nations. So we've heard all day, as far as policy tools go, how social protection is really undoubtedly one of the best mechanisms we have to address vulnerability, also poverty reduction and exclusion. And we've seen in the past 3 years how governments have stepped up across the region and used this as a primary tool to both save lives and livelihoods of millions of people. At the same time, we've also heard today that there's wide and growing recognition of the benefits of social protection, even beyond issues of vulnerability, exclusion, and poverty. It can generate additional positive multiplier effects on the local economy, for example, being a vehicle to empowering women and also incentivizing entrepreneurship. And it can also act as a catalyst, as many of us believe, for human capital development and to really remove the barriers to accessing services. In other words, I think from the discussions this morning, it's come out strongly that the case for social protection has never been stronger than it is today. However, there are a few important considerations. First of all, food security and nutrition are fundamental for the achievement of social protection outcomes and to really yield the multiplier effects that it can have. Good nutrition, as we know, is a cornerstone of human capital development to helping improve a child's cognition, their physical development, which then enables them to learn, to grow, to be productive members of their communities and their countries. And we know that we cannot achieve the aims of social protection if we really think about pulling people out of poverty, maximizing the benefits of social services, and strengthening their capabilities and resilience to withstand shocks, if we aren't also achieving food security and nutrition in parallel. So, I mention this because it seems like a well-trodden message, and it is. But on the other hand, I think it's fundamental to understand that social protection and food security and nutrition really are mutually enforcing. However, the pathway between them is not necessarily automatic. And what I mean by that is, income security, poverty reduction don't necessarily lead to food security. And food security, of course, doesn't necessarily lead to improved nutrition. So we can provide, social transfers, cash transfers to households without necessarily addressing some of the access issues in accessing markets that are disrupted or inefficient. It could also be the case that if our social transfers aren't sufficient or adequate, households might be forced to choose the food and other essential needs of certain members. Maybe it's the breadwinner or children, while women, people with disabilities, and other members of the family might eat last and less. We also know that, of course, just addressing food security and access issues doesn't necessarily improve people's diets. So quality and diversity of the foods they eat are another essential component. And of course, then there are other factors, including child feeding practices and water and sanitation, investments in health that are equally required. So the second point is that, to really leverage social protection systems and those programs to achieve food security and nutrition benefits really requires a systematic approach and a deliberate choice in how we target the types of transfers that we provide, the way that those are delivered through different channels, and also how they're connected with other sector investments, be it in agriculture, education, health, to name just a few. So there are some great examples in this region, and we will hear about some of them today. One of them is in Pakistan. And so, Naveed, let me turn to you. Pakistan has really made it a policy priority to work on stunting as not just in terms of the well-being of the population or a nutrition intervention, but also in terms of the impacts on the future economy. So I wonder if you can tell us a bit about Nashonoma, how what was the impetus for driving that program, and what you learned from building consensus to establish it. Over to you.
Thank you very much. So basically, there were two key drivers which basically helped us to, first of all, convince the policymaker to have the program like Nashonoma. I think these two drivers are very important for any program in the background to start with. So the first one is our nutrition numbers, the stunting numbers that we have. So since 1967, which is when for the first time National Nutrition Survey was carried out, the trend line tracking the nutritious status have failed to bring any change in the outcome of the stunting. And if we can share the recent National Nutrition Survey number, which we carried out back in 2018, the stunting rate is around 40%, wasting is around 17%, and underweight is around 31%. So with these high numbers for any policymaker, and since we haven't paid any attention towards prevention stunting, since the first nutrition survey back in 1967. So was the key drivers to place it before the policymaker to think about what we are wasting in terms of in terms of future population. So that was the major instrumental, and on the basis of that, what we did is that we spent a lot of time on designing the program very carefully. So usually There were many interventions that actually was started on addressing the stunting, but after 6 months or 1 year implementation is usually not able to catch up further and went back to the burner. So what we did is that we spent almost 1 year in consultation with development partners, with government entities, with provincial governments, health departments, and after that, we developed a design which was tested twice through an operational research. So we carried out an operational research in one district, we generated the evidence, and the operational research was almost for 3 years. So we generated the evidence, and then we, on the basis of that evidence, we placed it before the policymakers and the political leadership. And with the background of high stunting rate, we convinced the government that we should have some kind of program to prevent stunting. And we believe that social protection programs can play a vital role in addressing the stunting, because the food security is one of the main reasons of the stunting, especially in the poorest of the poor. Because they don't afford, they don't take the required calories, so they need some kind of interventions, they need some kind of a push. So conditional cash transfer, so we, on the basis of generated evidence, we designed the program and embedded with the conditional cash transfer, so covering all the elements of immunization, awareness sessions, providing the specialized nutritious food, and then over and above, antenatal and postnatal care, and over and above we are providing the cash transfer. So we designed this program with the support of the development partners and convinced the policymakers on the basis of evidence generation. The most unusual thing, not very unusual, but usually the implementation of or designing of the program in our country by that time was a different. Like since the MDG's era, the development partners used to design the program and provide the funds, and government was there to execute the programs. But through Nashurma program, this conditional cash transfer health and nutrition, we reversed the whole methodology of executing the project. So we designed, the government of Pakistan designed the program, we arranged the funding, and we then engaged the development partners, World Food Program, as an executing agency to implement the program. So that is showing the ownership and the political will to run any program. And I think without that, you cannot have any program implemented successfully. And we are into 4th year of our conditional cash transfer health and nutrition program. We rapidly expanded in all the districts. World Food Program is playing key role in implementing the program in all the districts. They helped us in executing it very quickly. With that, we are improving the implementation of the program. We are adding more components. We are adding social behavior change communication. We are focusing on the treatment as well. So going forward, we have a plan to because we are at the moment focusing on first 1,000 days of a child. Pregnant lactating women and children under 2 years are being covered. And now, since we are expanding it, have already expanded the program in all the districts, we are now including the adolescent girls into our program. And we have just started piloting it in few districts. And again, we will follow the same pathway of generating the evidence of any intervention, learning the lesson, and improve the design, and then expand it all across the country. So we have over 1 million families at the moment receiving the conditional cash transfer health and nutrition. And we are having our impact evaluation being carried out through an independent source, and soon we will have the results come out of that evaluation, and we will be sharing it with globally to help them also to design such a program.
Excellent. Thank you very much, Naveed. So, several kind of takeaways from that I hear. One is just, first of all, starting with the evidence that really helped to both inform the design, but also convince policymakers and the public of the importance of this investment. And then you also mentioned taking that forward with the upcoming evaluation. I think something else that's quite, maybe not unique, but really interesting about this program is just how you've layered all of these different elements and components, the social cash transfers with the counseling, with SBC and other components. And then the third thing that you really drove home was this idea of national kind of ownership from the time of inception, through design, through getting the right people on board and actually implementing it. So thank you. Nazma, perhaps I turn to you because Bangladesh also has, first of all, a very rich portfolio of social protection interventions. And you were responsible for two important ones, the maternal and child benefit and also the vulnerable women's benefit programs. So just within this very wide landscape with many programs, how did you manage to sustain the commitment from government with the many other programs, but also evolving priorities and commitments?
Thank you very much. First of all, I feel honored and privileged to be here, and I would like to extend my heartfelt thanks and gratitude to Asian Development Bank, WFP, and others for inviting me in this August panel discussion session. Before going directly answering your question, I would like to take the opportunity to make a brief overview of Bangladesh social protection portfolio in a short brief. You will be happy to know that Bangladesh is committed to eradicate the incidence of extreme poverty by 2031, and Bangladesh also committed to reduce the incidence of extreme poverty below 5% by 2041. And in this regard, government has allocated in this fiscal year, 23-24, 17% of total allocation for nearly 70% of total allocation for social safety net programs, and it is 2.5% of GDP. It was 3% of GDP during Corona pandemic, because there are some Corona-specific programs during pandemic period. And it is covering 29% of households who are getting at least one type of social protection programs, the poor households. And governments also adopted NSSS, that is National Social Security Strategy, in 2015. And government also adopted National Action Plan to implement NSSS in 2016. And recently, Bangladesh updated and revised that NSSS action plan for the period of 2021 to 2026. To make social safety net programs more efficient and tackle and prevent poverty, inequality, food insecurity, poor nutrition, and climate and other human-made shocks. To prevent those shocks, government is. And I am responsible for Ministry of Women and Children Affairs. You will be happy to know that Ministry of Women and Children Affairs is implementing two flagship program of social safety net. One is Mother and Child Benefit Program, and another one is Vulnerable Women Benefit Program. Under Mother and Child Benefit Program, Mauka enrolled pregnant women all over the country every month, and each beneficiary received Taka 800 as cash allowance, and it continued up to 36 months. What Pakistan said that we are also focusing 1,000 days from pregnancy to 3 years of children, because that is important for their physical and mental development. We call it cognitive development. And to support their additional and nutritional food during pregnancy period and after birth for their nutrition and childcare. And this makes quite a difference in the nutritional status of pregnant mother and their unborn child, because they are getting the allowance during pregnancy period. So, and this is also encourage them to enter into healthcare facilities, because it is mandatory to show the antenatal card when they get the allowance. So it is mandatory for them to take prenatal and antenatal care. Side by side, we are giving training to the mother and the immediate family members. We call it behavioral change communication. We give them training like not only beneficiaries, because the immediate family members like husband, mother-in-law, caregiver, and the community people, they also support them to go for healthcare services, to immunize their children. So we have taken this new initiative. It is very recent. We have taken this behavioral change communication initiatives. We go door to door of the people and give them training. And this program focused what we said earlier, 1,000 days of children. And this actually contribute to increase the rate of dietary diversity, what you said, and nutrition food of pregnant and lactating mother. And it also reduce their low birth weight, stunting, wasting, under 5 age children. And it is very much encouraging because they are taking antenatal care, postnatal care, and it reduces our infant mortality and maternal mortality as well. So what I can say that it has immense impact of our human resource development, because the population, if population become more healthy, more productive, the country will get more demographic dividend from those populations. So it is our main rationale to implement this mother and child benefit program. We have another program that is called Vulnerable Women Benefit Program that started early 70s. It's a long time ago. Before 40 years ago, we are implementing this program. But recently, we have redesigned this program, because in this program, the poor women, they get 30 kg rice. So only rice cannot improve their nutritional status. WFP and Finance Division jointly make a study, and according to their findings, we make a different type of, we redesigned that program. We separated 100,000 ultra poor women from the main component, and give them life skill based training that we can call income generating training. We train them how they can do businesses, how they can become entrepreneur, how they can explore self-employment. So we are giving them training. Side by side, we are giving 20,000 Bangladeshi taka after training, so that they can sustain after the program. And we make a linkage with business, entrepreneur, we make a market linkage with them. So this way we are trying to improve our, reduce our poverty, dietary diversity, nutritional status. We are trying our level best. Thank you very much.
Thank you very much. Thank you very much for that intervention. One of the points that I picked up that was quite interesting is how Bangladesh has really linked the current kind of demographic dividend that you have and connected that with the need for good nutrition to also be able to capitalize that and continue to grow. So thank you very much for that. Now, one of the critical success factors for social protection to be a catalyst, to really have these positive impacts, whether it's on diets or nutrition, is to establish concrete connections with other sectors at the time of the design, but also there are components that can be added later. Now, Namrata, Nepal took some bold steps, first of all, during COVID, actually, to expand its national school feeding program, and what is, I understand, the largest social safety net. But you've actually now taken that further and are looking at connections with your ministry in agriculture and working with smallholders. So can you tell us a bit about what you see as the benefits and trade-offs from exploring these linkages, perhaps the challenges as well, and trying to build partnerships with other ministries? Thank you.
Thank you, Kim. First of all, I would like to thank you for inviting me as a panelist, one of the panelists. Now, to begin with, the Ministry of Agriculture and Livestock Development is a federal ministry. Under that ministry, we have 7 different provincial ministries also working in agriculture sectors, and at local levels also. We do have small units which look after the agriculture sector, agriculture plus livestock sectors. So, first of all, I would like to talk about what we are doing, what Ministry of Agriculture is doing, and what is its future plans, which will, in a way, contribute to social protection. So, the Ministry of Agriculture and Livestock Development has initiatives which is aimed at leveraging investments in food security and nutrition as a part of the multi-sectoral plan in collaboration with the Ministry of Health and National Planning Commission. So, besides this, because there are many ministries which are linked to this program directly or indirectly. So, if there is interministerial linkages, they will bring a synergistic impact in building sustainable food system, improving food security and nutrition, providing adequate livelihood for small holder farmers, and contributing to environment sustainably. So efforts are also underway in promoting the homegrown feeding model in collaboration with the Ministry of Education, Science and Technology, and with technical support from UN, World Food Organization, realizing the immense potential they have in strengthening the local food system and strengthening the nexus between the nutrition, agriculture, and social protection. So we have also seen the opportunities how we can link the smallholder farmers with the National School Meal Program, which will also create the predictable market for the producers, supplying their so that they can even supply their food produced to schools and promote the consumption of nutrient-dense or nutrient-rich meals, as well as creating employment opportunities for women and the women cooperatives. So such linkages will also create or give opportunities for research and innovation in order to develop nutrient-rich varieties of crop and product diversification, and ultimately this will lead to poverty reduction, income generation, and improving livelihood. So the COVID-19 pandemic, this we already have experienced. This has shown, and besides this, the food, fuel, and the financial crisis which we have been facing time to time has pronounced the importance of feeding, school feeding programs and broader national food health and nutrition policies and programs in providing a crucial safety net for the children from who belong to the chronically poor and food insecure households. So, government of Nepal have been allocating budget, I think nearly $27 million in 2018, and which has been increased to $87 million in 2022. So we can link the smallholder farmers to this program so that they can produce their crops and they can even get the market. So we are planning in that way. So besides this, the plan includes school meals as an important component to contribute to maintain the food system while improving the nutrition and quality education to the children. So the government Nepal has planned all this. So I am pleased here to commit on behalf of the ministry in promoting multi-sectoral nutrition plan, food and nutrition, by bringing together the health, agriculture, education, and social protection sectors among the others to strengthen the sustainable and resilient food systems in Nepal. Thank you.
Excellent. Thank you very much, Narmata. And a couple of takeaways. I like your vision of using the National School Meals Program as a way to support the transformation of food systems in Nepal. And you mentioned this untapped potential, working with women smallholders and connecting them to supply nutritious foods at school, and also the interesting point around research and development when it comes to improving crops, and how that might to address some of the issues of climate risk and drought and other issues that the country is facing. So thank you very much. Richard, if I can turn to you, we've heard from our panelists some of the strategies and programs that they've been working on. Now, as far as your work and research in the region and also elsewhere, are there other examples that we should be looking at, and what does the evidence tell us? Over to you.
Thanks, Kimberly. Thank you to the fellow panelists. Well, I've thought nutrition is important, actually very central to our lives ever since I was a young person and went for the first time to a poor country, and I couldn't tell how old the children were. The teenagers, I thought, were 8 or 9 years old, even 7, 6 years old. When I spoke to them, I found out that they were 13 or 14, and I was very shocked because they were so short. It was a wake-up call for me. So this has led, I think, to my concern about human nutrition, particularly child nutrition, maternal nutrition, which are intricately linked for the past few decades. In Nutrition International, we've been carrying out a survey across Asia looking for some of the best practices in terms of government policy for promoting and trying to get more impact for nutrition through these major social protection platforms. Some of them are long-standing, some of them are new and emerging, but in many cases we see in Asia this focus on nutrition as a goal in its own right, that stunting should be reduced, as Naveed was clearly saying from Pakistan, from BISP Nashinoma. You asked about other examples. I was going to talk about Nepal's child grant program. The secretary is sitting next to me, so I'm going to be quite shy to do that in her presence. But Nepal has been successful, according to the evidence and surveys, in reducing child wasting and underweight in association with the cash transfer program to mothers and children and its links to the health system, the promotion of growth monitoring and the use of health services. I would say another major example, which we heard about earlier in this room but hasn't been covered here, is Indonesia's PKH, the Family Hope Program. Very interesting program because it's been going for a couple of decades now on a consistent basis, reaching large numbers of Indonesian families. And even though ESCAP and ILO's reports say it's not well targeted, it's one of the, according to them, least poverty targeted programs in the region. MIT's work in 2018 indicates that it's had major success in reducing child stunting among young children by several percentage points in comparison with control or non-recipient groups. It's not clear why. I'd love to, and we'd love to be able to research why this success in Indonesia, and we hope similarly will come out of Pakistan with the evaluation that Navid talked about, with the success in Nepal with the child grant program. What are the pathways towards which nutritional progress can be achieved? Is it improved diets? Is it improved use of health and nutrition services, growth monitoring so that parents can tell if their children are not growing properly and according to the recommended schedule? Is it increased knowledge and behavior, child feeding practices in the household? Or is it something, totally beyond that, the growth of the economy and macroeconomic factors, the so-called trickle down to poor families who get more economic opportunities? Well, most likely it's a complex combination of these. But these examples in Asia show very clearly that, firstly, if governments target nutrition in its own right and as a human right, that every person, including every child, has the right to grow up well-nourished in order to become a productive and fully realized member of society. You focus on that as you use social protection as one of your tools or weapons, if you like, in the fight against malnutrition, you can achieve progress, you can achieve success. And secondly, if we approach social protection creatively and link it to other sectors, and we talked just now about the intersectoral linkages with agriculture, livelihoods, school feeding, but also health and nutrition and WASH, if we think about what the critical linkages are between social protection and these other sectors that are also fundamental to good nutrition, we can figure out what is the combination of interventions, of policies and programs that will drive better nutritional outcomes in Asia and beyond. Thank you.
Excellent. Thank you very much, Richard. So you've given us more food for thought, both another example in Indonesia that's worth further exploration, but really appreciate you pointing out that although we can see the benefits of these programs, there's still more to do to really unpacking and understanding what pathways are perhaps the most effective in achieving the outcomes that we're aiming for. So thank you for that. Ladies and gentlemen and colleagues, now is really the best part of the panel, which are your questions that you have for our experts here. So I have a couple of colleagues in the room, I think, who will bring the mic around. If you wish to speak, please put up your hand. I see a few of you have already. If you can just, when you have the mic, introduce yourself, your name, your institution. If I could very respectfully ask that you keep your questions quite succinct, just so we can manage time and get to more questions in the audience.
Yes, of course. Hello, everyone. My name is Bakhtibek, World Food Program, Tajikistan Country Office. I have a quick question to Mr. Navid Akbar and Ms. Nazma Mubarak. You both mentioned that it's very important to support the children during their first 1,000 days. However, under the school feeding strategy until 2030, WFP argues that it's very important, although it is very important to support them during the first 1,000 days, if we want to sustain the good health and nutrition, we should continue supporting them until they are 8,000 days. So my question is, to what extent do you agree with this statement, and whether or not your country has been thinking of increasing the number of supporting days? Thank you very much.
Thank you very much for the question. Let's take one other one, and then we'll turn over to our panelists to respond.
Yeah, I am Pradeep Bagiwal, Regional Inclusive Governance Specialist for Humanity and Inclusion from Southeast Asia region. I have a common question for the three panelists representing Government of Bangladesh, Pakistan, and Nepal, and also to you, Mr. Richard Morgan. given the fact that there's a growing evidence that persons with disabilities and children with disabilities are often excluded from food security and nutrition interventions. So if there's anything specific that you would like to share as to how the needs and concerns with regards to food security and nutrition of persons with disabilities and children with disabilities has been mainstreamed in your respective programs. Thank you so much.
Excellent. Thank you for those questions. Okay, Nazma, would you like to start? And then I hand over to Naveed.
Yeah, what you asked, that we are giving the benefit to through Mother and Child Benefit Program for 1,000 days. You know that, 1,000 days are crucial, we all know. That's why we started this program for 2 years. It was up to 2 years of the children. Now it is up to 3 years. So we are gradually increasing the time spent because of, the resource scarcity of the government. It is not possible, and you know that just COVID pandemic is over. Now we are in economic crisis due to Ukraine-Russia war, and it is not possible to make it 8,000 days overnight. So it will take time. We'll gradually do it. Thank you.
Yeah, so you asked the question that if there is an agreement on this. Yes, there is an agreement that we should have, an increased coverage in terms of days, 1,000, 5,000 or 8,000 days. It's all depend how much resources you have with you. So we have just started this program intervention with 1,000 days because we believe that we all know that stunting is irreversible beyond 1,000 days. So looking after the numbers that we have, the high number of stunting in Pakistan, so we at least started focusing on preventing stunting during first 1,000 days. And then even we are going beyond by adding the adolescent girls from 15 to 19 years so that we can, have that component covered as well. So our objective at the moment is to first focus on first 1,000 days, then parallelly we are piloting on the adolescent girls conditional cash transfers. And then if we will have the more resources available, because all social protection programs really dependent on the financial availability by the governments. So whenever we will have the funds, or any country have the funds, they should explore to have all the components included in their programs. And sometime not only the days, but you have to see, because we all know the nutrition or stunting has a many, is a deprivation has a many drivers. So it's not only probably we are covering one component, but there are more components like water, sanitation, and food insecurity, many drivers that we need to focus on, and the different government organization has to focus on that.
Thank you very much for that kind of honest reflection, also just in terms of the current limitations with fiscal space, but recognizing the importance of kind of going beyond the 1,000 days and the other interventions that you have. Narata?
Yeah, to his question, it is not directly related to Agriculture Ministry, but in Nepal, Ministry of Health and Population, it has been engaged in such programs, and the multi-sectoral national plan, it incorporates all those things. Thank you.
Maybe I can respond on that. Yeah. So yes, person with disability, we should focus under social protection program, and we did it through our program. So we are covering bottom 2 quintiles in all our programs, like our unconditional cash transfer and the conditional cash transfer. Both we have the education conditional cash transfer and this health and nutrition conditional cash transfer. But specifically for persons with disabilities, we have raised our eligibility threshold, and we are also covering the 3rd quintile of the households having presence of any person with disability. We are actually making them part of the program and like not only first 2 quintile, but the 3rd quintile as well. So we have a special focus as a program to cover this vulnerable population in the program.
Bangladesh, we have allowances for persons with disability. We are covering all the people. They enter into our database with doctor's certificate. We give allowance to all the disabled peoples. It's within our program, social safety net program.
Thanks. 2 things. On school meals, I feel these are often a missed opportunity for promoting nutrition. They're not nutrition interventions per se. They're very good interventions for many reasons, educational, food security, and so on. But to get nutritional benefits from school meals, I think would need layering onto them, combining them with additional interventions in the school setting, such as nutrition in the curriculum, supplementation, particularly for adolescent girls who may be suffering from anemia, linkage to health services, which can come into the school and provide nutrition counseling, and also paying, I think, very careful attention to the composition of the school meal in a dietary sense. And here I think there's a challenge for the community, because moving towards homegrown school feeding, which makes a lot of sense in many respects, may put at risk the ability to provide nutritious, balanced, and fortified, particularly fortified foods, staple foods. So I think this needs attention, that as school meals expand, the issue of meal quality also needs to be taken into account. So I hope that will be borne in mind. The other thing, on the disability issue, and I'm much more familiar with the situation in parts of Africa than in Asia, I have to say, but there's a paucity of data, and therefore the challenges and the rights of children and persons with disabilities becomes invisible because it's not brought out by data. And also in some countries, there's a stigma attached, and families tend to want to hide rather than put forward, the fact that they have persons or children with disabilities in the family, and therefore the question of access to benefits becomes problematic that way. Thanks.
Thank you very much, Richard, especially the last point around how we actually deliver services to children that have a disability. And you're right, I think we know there's an underreporting and just a lack of understanding of how many children we're talking about. But as you mentioned, just to access services, to access information can also be a challenge to mainstream into these programs, so thank you. Okay, can we take another round of questions from the floor?
I have 4 more from the floor.
Yeah, thank you. This is Mamun from WFP Bangladesh. I don't have the question, but to complement with Richard, I mean, as you was asking that how social protection is contributing to the stunting and wasting. Actually, in 2018, Bangladesh government, World Food Program, and International Food Policy Research Institute, we had a research, transfer modality research institute. So that's actually provided the proof of concept that if you provide cash with quality BCC, that could significantly reduce the stunting and wasting. And I think that's one of the model or the proof that we have supported Bangladesh government to design this mother and child benefit program. And the other point also for the Richard, that we also should not forget about the importance of fortification. I mean, to complement the nutrition elements. So largely fortification, rice fortification could be an option for the countries that also could implement it. Thank you.
Okay. If I can please ask that we focus questions, not because we're not interested in the comments, but just we really would appreciate your questions for the panelists. Yeah.
Okay. Here's a question then. I'm Franz von Rönne. I work for GIZ, German International Corporation, in Pakistan. I work very closely with the Benazir Income Support Program and also with Nashonuma. And I also have other interests in adolescent girls' nutrition, for example. I've also had some experience in large-scale food fortification in the past. So the whole subject is very near to me and dear to me. I have a question especially to Richard and Namrata, but basically to all. You said, Richard, that there is, one should look at nutrition as a program on its own or for itself or per se or something like that. I don't find the right words, but I know the topic very well, because I think, unfortunately, nutrition is very much caught up between different sectors. And here comes my question. What do you have to say about the needs to redirect maybe or build governance for nutrition programs, which are now traditionally between different sectors, which are known not to be able to jointly really provide us the focus that this topic needs?
Thank you. Thank you for the wonderful presentations from the panelists. I'm Dr. Akhtar Imam. I'm working at the Bangladesh National Nutrition Council under the Ministry of the Health and Family Welfare and working as the Deputy Director. My question to the Secretary, Ministry of the Agriculture and Livestock Departments of Nepal. Madam Secretary, you were speaking like for having the multi-sectoral activities or multi-sectoral nutrition action plan. Because in Bangladesh, we have been implementing the same thing like National Plan of Action for the nutrition. It is a multi-sectoral program for a 10 years plan, and also in comprising of the 22 ministries are contributing in terms of the achieving the nutrition targets. And in that plan, we have specifically a thematic area for the social protection schemes and programs. So I actually want to know that if you have any kind of that program for the national program, and if it includes with the multi-sectorality, how you are thinking to include these social security programs in your multi-sectoral nutrition activities. Yeah, thank you very much.
Sorry, I missed who that question was for. Was it for one panelist in particular?
You are asking me?
Yes.
Yes, I am asking the Madam Secretary from the Nepal.
Okay,
yeah.
okay. Over to you, Namra.
Thanks very much. And first of all, thanks WFP colleague from Bangladesh for pointing out what is a gold standard piece of research done by Government of Bangladesh, WFP, and IFPRI, showing that cash transfers combined with behavioral change communication sustained over several years has a strong impact on stunting. It is an important piece of research. A colleague from GIZ or GIZ, I'm never sure which one. I'm British, so GIZ, if you don't mind. Yeah, brilliant question. Okay, I'll give you the short answer. It could take an hour to say, well, what are the conditions for nutrition governance? Number one, clear, explicit, high-level political priority, preferably from the head of state. National mission to reduce stunting to dramatically low levels and other forms of malnutrition. I mean, we have to recognize obesity and it's linked to health conditions coming in now in many countries as well. So making nutrition a national mission. Putting the accountability for nutrition in government at the highest possible level. In some countries, Timor-Leste, for example, the stunting reduction unit has been placed in the Prime Minister's office. That gives it the ability to hold other ministries to account, but also to help them work together in a positive and integrated way. Number three, a national nutrition plan or strategy, which combines programs in a clear way and encourages coordination and not just coordination, but effective integration across programs. And that would include social protection, because it's not only in some cases social protection programs haven't included nutrition, but nutrition plans haven't included social protection. So, you know, there's a potential blind spot on both ones. Fourth, clear, dedicated, adequate budgets to invest in nutrition in a sustained way over time. And fifth, data of all kinds, quantitative, qualitative, from families, from communities, feeding upwards, as well as statistical data feeding downwards, and public access to the data so that countries, societies can see how well they're doing in tackling the National Nutrition Mission. I think those are some of the elements of effective nutrition governance.
Talking about the multi-sectoral activities as you have raised, Ministry of Agriculture is one of the stakeholders for the multi-sectoral nutrition plan. But the activities of the plan is not directly implemented through the ministry. It is implemented through the Ministry of Health and Education. But besides this, some of the projects which are under Ministry of Agriculture, they are also working not directly in multi-sectoral activity, but they are engaged in food security. They work at the local levels in improving the food security and nutrition. Basically, they are working in women cooperatives. But the activities, multi-sectoral activities, they are not directly implemented through our ministry. Thank you.
Thank you very much. Naveed, I wonder if you want to take also this question on kind of nutrition governance or nutrition, social protection governance that cuts across multiple sectors. As a gentleman from GIZ was mentioning, I mean, there are a lot of challenges we know and how to actually do this in practice. So I wonder if you could speak from your own experience about what some of those challenges actually are and how much you've been able to overcome them.
So I think France is quite aware of challenges that we face in Pakistan. Yes, there are many challenges, but I think against, if you can have, as I mentioned earlier, if you have something evidence-based, you can always convince and you can overcome those challenges. So I think whatever you want to start or introduce, probably you need to generate the evidence out of that. And then you can always convince the policymakers to take even a bold step to have the more investment, because usually as a practitioner, what we do is that we quickly try to get the results out of any program, and without designing properly and without implementing it properly, it usually gave us and usually program failed because of its implementation and design. It's not because of their actual intervention. So if you plan it properly, if you design it properly and then implement it properly, then you can certainly get the results out of that. So that is, I think, the most important thing.
Okay, I need to apologize because I think we're running out of time, so we'll have to close the Q&A. But thank you very much for your questions. Panelists, you've brought us some great insights into the work you're doing, the programs you're running, the research that you're part of. Let me just hand over to each one of you for just a few final words. If you have any reflections from the session today, any additional reflections, challenges, or things that you would like to share. So just a few brief words.
Okay. Thank you. I can supplement some of the challenges we faced and how we overcome that challenges. In Bangladesh, we have faced many challenges, but within those, the main challenges are selection of beneficiaries, actual beneficiaries, and make the payment system more accurate and timely payment system. In this regard, we actually digitized the system. We developed an online self-registration platform to fill up the application form for the safety net providers. And we developed a web page for them. We developed mobile app. We also developed a video manual so that the people can understand how they can fill up the forms. Before that, there are some middlemen. They really exploit the poor peoples and the illiterate peoples. They don't know how to fill up the form. So this online self-registration system eliminate those exploitation. And we have some union digital centers in the village level, in the we call it Union Digital Platform. And people can easily go there because it is beside their home. So people easily take assistance from those people who knows the technology. And we have one project, we call it Tothapa in Bangla. There women volunteers are there. They go door to door to the people and help them with computer, how they can fill up the forms. So that makes a huge difference to eliminate middleman's exploitation. We have also introduced a digitized payment system. Through a platform, we call it Integrated Budget and Accounting System. The beneficiaries or the departments, agency, they send data, beneficiaries' data, into a central MIS. We call it SPBMU. And within that database, we can validate whether this mobile number and this NID, we have national NID, identification number. We validate their mobile number with the NID number, and validate their pictures and other information through online. And we also validate overlapping, because people are getting other benefits, other social safety nets. Sometimes people are getting pension. Sometimes people are in job. So we validate those who are actually vulnerable through the online system. And we make payment through that system. At first, we validate their information. Then we give their payment through electronic fund transfer. It goes through mobile financial institutions. There are some mobile financial institutions. We send this money through that system to the beneficiaries' selected account. It may be he can easily take money from the shop nearby her home. So it's very easy process. So we try to digitize the beneficiary selection system and payment system as well. Thank you.
Thank you very much for explaining some of those innovations in your programs as well. Naveen?
Yeah, so I think in one line, the reflection is that how to make a program a comprehensive program in terms of, including all the components in it. Probably we are implementing part of the issue, part of the problem, but there are many other things that we can collaborate and we can add in our interventions. We talk about 5,000 days, 8,000 days, and how to make our existing 1,000 days a comprehensive implementation to generate more results out of that and have the value of money at the end.
Okay. Speaking about I'll just speak about the agriculture part. Speaking about the farmers, 80% of the total number of farmers in Nepal are smallholder farmers. So I think if we can address those 80% of the smallholder farmers, we can really achieve the goal of the social protection as we are talking about, because most of the farmers in Nepal are 80%. So first, social protection. It's social protection, in my view, is an umbrella, and each and every sectors has to come under that umbrella. So we have to work in close coordination in order to achieve the social protection we are talking about. So, talking about the challenges of Nepal, I will also speak 2-3 challenges. One of the major challenges in Nepal is the weak coordination between the different stakeholders. So it is the major problem, especially at the time of planning and budgeting. So if we can address this challenge in some way, we can achieve our goal. And the second challenge in Nepal we are facing right now is the identification and the selection of the beneficiaries, as Madam Secretary has also mentioned. But we are in progress for the identification of the farmers. Then about other things I've discussed. Okay. These are the two major challenges we are facing in agriculture. Great. Thank you.
Thank you very much. Richard?
How long have I got? 1 minute? 2 minutes?
Oh, you're okay.
I'm okay. All right. Well, first of all, I want to thank the three panelists for the country case studies, no example, inspiration from each of your efforts there. And I wish sometimes colleagues from Asia could come to where I live in the UK, where we have lots of hungry children. About 25% of our children are food insecure, and most of them don't get school meals. So if you can come convince, some of our decision makers, I mean, the watchword is, they say we can't afford to, and we've heard, some examples here. We can't afford to expand coverage, include more children, address malnutrition. Well, the counter-argument is that you can't afford not to. That the costs of inaction come back to haunt you, to bite you. They cost your public health system, they cost your economy. We know that where I come from in the world. I think it's increasingly recognized in Asia, where countries are now taking bold steps, in some cases spurred on and accelerated by the shock, the terrible shock of the COVID pandemic, actually has a small silver lining of incentivizing and accelerating responses to some of the deeper problems in society, like malnutrition among children and women. So, the costs of inaction, I think, are being recognized, are being addressed, and the examples here have shown it's possible, it can be done. We've mentioned other countries that are taking similar steps to focus on. If you start with the first 1,000 days, that's the starting point. You build on that. The stunting takes place normally within the first 2 years. It can be addressed, it can be to some extent reversed, but you don't want to give yourself the double challenge of having to reverse it. So best to start with children in the first days and months, and their mothers, who are so intimately linked to their own children's nutrition. No missed opportunities. We've talked about how other programs, school meals has been one example, but also livelihoods programs, so-called graduation programs, labor force programs, things like looking at maternity leave provisions as well, provide opportunities for promoting that virtuous cycle through mothers, through parents of children who are born with adequate weight, who are well fed, who are well nourished, and grow up healthy, ready to learn and ready to be prosperous and productive in society. Thanks very much.
Thank you very much for those words. In fact, I think that was almost a good wrap-up in a way of several points. So let me try to draw us to a close and actually emphasize a few of the points from our esteemed panelists. We have said from the outset that we live in a world that's yet to recover from the shocks of the past few years, where we are not on track as we would have liked to be and should be to address not only poverty but also nutrition and food security issues, or the elimination of hunger in particular. We've also said, and Richard, you put this quite nicely, there, as much as there is a cost financially to these social protection systems and the investment, there's also an even greater cost of not doing anything. And that just reminds me of just some of these global figures, 3 trillion, dollars, lost in productivity by not addressing malnutrition. So I think that's a really important point for us to just come back to when we, kind of face these questions around, the cost of social protection and food security and nutrition programs. I think what's also come through today are obviously some great examples of how social protection can be leveraged to improve nutrition and food security outcomes. Clearly, more needs to be done to kind of build these synergies, as several of you have mentioned. Some of the programs that are kind of ideal for drawing those synergies, school feeding being one that was mentioned. But I thought there was also a really good example from several of you actually about how you can pull together different components in very much a layered way to support nutrition outcomes, support social protection outcomes, but also having these multiplier effects to other sectors as well. And we also talked about some of the remaining challenges when it comes to selection of beneficiaries that we're trying to serve. Evidence was another issue that came out prominently, both its importance and how it has helped to inform the design and convince decision makers, but also the fact that we still need more evidence to continue to understand these pathways in the right way to design interventions and convince those who need to be convinced that this is a good area to invest in. So we need systems that are better targeted. We need them to be more inclusive, as the gentleman mentioned. They need to obviously be more agile, and we need more data and evidence. And then we've talked about the cost of doing this. I think the other thing that's come out quite clearly is the fact that this multi-ministerial or multi-stakeholder coordination is essential, both in terms of food security governance, getting buy-in, and actually coming up with a multi-sector set of interventions that will address social protection and food security and nutrition outcomes. And then lastly, let me just kind of pose a question, and also challenge a bit. If we believe that social protection systems really should be leveraged to improve food security and nutrition benefits for all of the reasons that we've discussed in this panel, both the potential for human capital development, for economic development and growth, then I would challenge us all to think about what more we can go back and do in our respective institutions to really making that happen. So that next year, when we convene this meeting, we can say we tested some new things, we tried. We might have failed a few times, but we tried. And we've actually hopefully made some demonstrable progress and kind of using these systems to create much bigger impacts that will also be obviously cost-effective as well. So with that, I'll wrap up. I'd just like to give my thanks to our panelists for their great interventions, and thank you all for the excellent questions. And have a great evening.